They've helped thousands with chronic illness and serious medical conditions for the past 2 decades. Now, Turning Point is helping those with long-haul COVID cope with their symptoms. The Morning Medical Update starts right now. And good morning to you. It is Thursday, May 19th. Thank you so much for being here with us on Facebook, YouTube, and on Twitter. Coming up a little later, you've seen them all around town. Now you can check out all the heart art that's part of this year's Parade of Hearts and how one app is making it possible. Coming up in about 15, we'll get the COVID count with Dr. Dana Hawkinson. But first, it's not just physical, but mental too. The impact long-haul COVID is having on people and the organization helping them deal with it all. So get your questions sent in to us on YouTube, Facebook, and email us at the Medical News Network. You can find links to those right there on your screen. Well, about a fourth of COVID-19 patients develop long-haul symptoms, and in many cases, they last for months. The condition can affect anyone, old or young, otherwise healthy people, and those living with chronic conditions. So imagine having no support, nowhere to turn. Well, that is where Turning Point comes in. Joining us this morning to talk about it is Jill Vonfange. She's a social worker with Turning Point. And also joining us is Alexis Del Cid. She's one of our anchors and reporters here at the health system. And you're going to talk about your experience. So ladies, thank you for joining us at the desk today. Joining us virtually is Kelly Hallou and Stephanie Parker, both who have been battling COVID long-haul symptoms. And they sought out the services of Turning Point. So we're going to hear all about their experience, how it started and where they are today. So Kelly and Stephanie, I do want to get started with you. Again, thank you for being with us and sharing your story. Let's just start. Kelly, tell us a little bit about what symptoms you started dealing with and what you're dealing with now.
Started out with a shortness of breath where I required oxygen, and then later developed brain fog, difficulty finding words. I also developed tremors that were hard enough where I could not write very well. Anxiety, a very big part of it, and depression.
Has any of that let up, or has it gotten worse?
So I still have the severe anxiety and depression. The tremors were getting better now that I'm on medication for them. My breathing's a lot better. I still have a little bit of fatigue, but I'm able to find words better than I used to and to talk, because it was difficulty getting out what I wanted to say, and that's improving.
So I want to get the timeline. Kelly, when were you diagnosed with COVID?
October of 2020.
Okay. Stephanie, when were you diagnosed?
November of 2020.
Okay, so here we are in 2022. Stephanie, those symptoms sound familiar that Kelly was talking about. Anything different? How are you feeling today?
Yes, definitely some of the same symptoms. I was hospitalized for 12 days and ventilated in the ICU. So we're still working through which symptoms came from the hospitalization and which are from COVID. But I still have areas of my body that are numb, specifically on my left leg and the right side of my head. COVID also affected my eyesight, so I had to get glasses for reading. I experienced some short-term memory damage, so I still have difficulty remembering some short-term things, like if I close the garage door or things like that. I have to write a lot of lists down now. I also have the fatigue. Whenever I exercise, my heart rate gets very, very high. I also experience the anxiety and depression as well.
And that's where Turning Point comes in. We're going to talk with Jill here in just a moment, but Alexis, I mean, that's a worst case scenario.
Yeah,
you also had COVID, but you've been reporting on people who've had COVID, who get these symptoms. It is frightening. We've talked about how scary it is, not just to get COVID, but to then experience these things that you've never experienced before. Then you get it.
Right.
How long ago was it that you were
weird.
diagnosed?
So I got it recently compared to Kelly and Stephanie. It was last month, April 10th. And it was really stunning to me how quickly and how very, very sick I got so quickly, being vaccinated, 2 shots and boosted. And I was down and out. I got a monoclonal antibody infusion, but and I can't ever compare myself to Stephanie and Kelly or the other women we've done stories on, like Michaela Dreyer and Terry Potts, or Terry Allen, who they both have POTS. But the brain fog that Kelly is talking about and Stephanie's talking about has been unreal. I remember when I came back to work finally, I couldn't remember your name. I could not for the life of me, Jess, remember. I was trying to get your attention across the room. At one point, I called you Kathy. I was talking to someone whose name was Wayne, and I called him something completely different, like Moses. I think I transposed the M and the W. It was weird mistakes that I was making, and writing down the lists and having to feel like you're always in this weird fog. I don't know if that qualifies as long haul because it's been a month and a couple of weeks, and I guess I would ask Jane that. Is that long haul, or is that just I'm coming out of it now? Is it?
Yeah, what are you saying? I mean, we talk about long haul. When we had our long haul clinic, a lot of it was you had to meet certain criteria and it had to be a long time. But and I would imagine long haulers they run the gamut of time and symptoms and things that they're dealing with. But what are you seeing as far as what's been qualifying for long haul?
You know, and I think that's a really good question for the medical professionals, because I know that early on when we started this long COVID support group, and we talked to, at that time, the long COVID clinic, if you will, and the specialists, we were kind of looking to them to give us what the qualifiers were. And so at Turning Point, we're not, I would be honest, like I'm the person that screens people. I really, if someone contacts us and says that they have long COVID, I don't really go into give me exact dates, exact information.
You just want to help.
They're suffering, they're saying that they are having some long COVID symptoms, then we're going to give them support over the phone, and then also encourage them if they would like to attend the support group.
Well, on that note, I do want to bring in Dr. Hawkinson on this because, go ahead.
So I called you Jane and it's Jill.
That's okay.
But that's the case in point. I literally met you 5 minutes ago and shook your hand, and your name just, it went out.
Well, I know, and that's kind of the scary part that you talked about. But you get a pass.
Weird.
Guess what? You get a pass
today.
Today, right?
Today.
But Dr. Hawkinson, that's something that has been a big issue for people, and I think has led to a lot of people having anxiety and depression, is people not believing that they have long haul, or having to prove that they have long haul, or is this really a thing? And I think to Jill's point, it's like, who cares? You had COVID, and now life has changed in many dramatic ways. Just on the medical side, talk to us a little bit about that.
Yeah, I mean, certainly this moving forward is going to be a huge public health epidemic. It will be an individual health epidemic because long COVID does affect so many organ systems, basically every organ system. And some people may have some symptoms or one symptom of something, and then other symptoms other people may not have, and so it is so heterogeneous. There is such a variety there. We are doing more to learn about it. We know that the government has put forth a large initiative to try and learn more about it and also seek treatment for that. And so moving forward, it will continue to be an issue, both for our healthcare system, but of course for those people that are impacted individually, for them and their families as well.
Thank you for pointing that out. We're going to get back to our guests here in just a moment, who are both dealing with long haul COVID symptoms and in cases that have been quite severe. But Jill, I just want to bring in and talk a little bit more about Turning Point. What type of services you're providing, and how you kind of pivoted who you were helping when this pandemic hit.
So we've always been in the community for 20 years now, 21 this year, and we provide support through programs, classes, presentations, and support groups for people who have a serious and chronic physical illness. And we also support their supporters, so their caregivers, whatever that looks like to the person that has the illness. And when we started hearing about long COVID and the suffering that people were experiencing, we realized that there needed to be some type of support specifically for someone with long COVID. While we have maybe some general classes and presentations that can help them, people that have an illness and a long-term chronic illness, possibly like long COVID, they need to find other people that they feel heard and valued and not alone. And so often when someone's come on to the support group, often, even like on Monday, a couple of people who had joined the support group were like, I don't feel alone now. Like they felt so alone and not seen because their family members are like, oh, you're over with COVID. Oh, everything should be okay. And that's not the experience that they're having. They're having long-term concerns and problems, and they needed to be able to feel heard and valued and share their stories and find a commonality with other people that are experiencing something similar. So that's what we do in the support group, is share stories and successes and hard days, fears for this to be a chronic illness, which is more managed than treated. And so, there may not be a cure for a lot of the symptoms that individuals are experiencing. And so this may be a lifelong chronic thing, some of the symptoms. And so coping with that is what we talk about in the support group, and then get support by hearing from other people, maybe what they did or what they tried, or a doctor that they found that heard them, that listened, that maybe didn't have answers, but at least said, I don't know, we're trying to find out, or here's what I know that other places are doing. So I think that's
I sense Alexis like hanging on your every word,
Yeah.
because you're hearing from Jill, you're
Yeah.
hearing Stephanie and Kelly
Yeah.
talking about this. I mean, can you imagine this being such a big help? I mean, I know you've sat there
Huge
kind of
help.
feeling isolated, going, what is going on? I feel weird. I don't know how to explain how I feel weird.
Right.
How do you
feel like
explain-
everyone's looking at you, and I don't know if Kelly and Stephanie feel like this when you're out in a situation and you're talking to people. I feel like there was a time the first few weeks where I was like, act normal, you're doing okay, you're not looking weird. And I don't know if they can relate to that, but you feel like you're in this weird haze. And what was so comforting, what Jill is talking about, is talking to one of the doctors here, Dr. Brandon Comfort, who's got the best name ever for a doctor,
Right.
Dr. Comfort. And he just said, here's my cell phone, call me. And he just completely validated everything. Yes, we've seen this. Yes, here, you got it. He told me, and I'm sure everyone's heard this by now who's gone through it, he said they're treating a lot of these symptoms like you would treat a concussion or a brain injury. And but it was so comforting to talk to a doctor who validated it, said he'd seen it, and gave me some things to do that might help.
Stephanie, Kelly, can you relate to that? What has been one of the bigger, Stephanie, I'll start with you, just day-to-day life, coping, managing, how have things changed for you since this diagnosis?
A lot has changed, honestly. It's how I approach every day. The brain fog is real and affects everything. So I make lists upon lists. There are Post-it notes everywhere, because if I think of something and I'm like, oh, I need to do this today, and then I think about something else, I've already forgotten. So unless I write it down, I'm not going to remember to pick it back up. And it's a lot. It's learning to adjust your expectation of your physical abilities. It's learning how to, like was already said, learning how to talk to other people about it too, because when you get looked at, it doesn't look like there's anything wrong, but I know that things have changed with my body and my brain, and it's hard to figure out how to balance that.
Kelly?
A lot of the same thing. I have to do sticky notes. I'm a registered nurse that still hasn't been able to return to work because I can't multitask. And I don't go out to lunch with my nurse friends anymore because I feel like I'm stupid, because I can't remember things. I will be talking about something, I'll forget what we're talking about. I also have the same problem as forgetting their names. I will call them a different name, and I've known them for a while, and it's been very difficult because it was talked about that I forget so quickly. If I don't make that note and I think about something else or somebody interrupts me, then I totally forgot what I need to do. And it's hard when you look good on the outside, but it's inside that nobody's understanding. They think we're faking it, is what it's like. I feel like they think I'm faking it. They like, I had COVID, I'm fine, so that's been rough.
Yeah, that would be maddening. But you've really, both of you ladies have expressed and described exactly why this support group at Turning Point is so badly needed. You need people to validate you. And Kelly, just hearing you talk about not being able to go and spend time with friends, which is what you need right now, that hits home. So I just want to talk about the brain fog is something I hear a lot, but this anxiety and depression, Jill, that it's really it's just like a snowball effect, and I can't imagine what they're going through. What kind of things are you talking about to help with this anxiety and depression?
So what we do in group is we do a lot of sharing, and I think, again, hearing from other people and knowing that they're not alone. And then we're encouraging people to talk about things that have gone well for them, for sharing what they are doing to cope with communicating with family, relationships, helping family members understand, that you can't see my brain fog. Maybe you can. But I think with anxiety and depression, I think that goes along with it too, is like some people don't think they can see it. But if you look at a person's actions and behavior and even some of their statements, then I think that then people can tune in a little bit better and see that they're suffering, beyond the brain fog, that and changes like not going to something, like Kelly talked about, not going out with her nurse friends. That it's probably, yes, because some of the brain fog, but it's also too, probably some of the depression piece, just kind of feeling like, well, I don't want to get out today. Or, I think Kelly's talked about, that just wanting to be home because that's the safe place. Like, I don't have to face anyone that might not believe what I'm going through.
Don't have to explain yourself.
Right.
Who wants to have to do that?
Yeah.
I want to get to a question from one of our viewers, and it's for Alexis. Just what were the first signs that you had that you were having? You had COVID, and I remember when you texted me and you said, I think you were at an appointment, and you said, I'm having like I
got a hot
sick.
flash.
Yeah, and you said, I'm sick, I'm going to go home, and then we found out you have COVID. But then what was the first sign that you thought, this is sticking around?
The once I was out of the quarantine, or I can't remember if it's 5 or 7 days now. You can go back to, it was like 7 days, but after the fever was gone, I could not get it together to do anything in the house. I could not get it together. I was still home, and my husband would come home from work, and I would just be like sitting on the side of the bed. And that's weird. I'm a busy bee. I'm busy, talk. And I'd just be sitting on the side of the bed. He'd be like, how long have you been sitting here? And I would not know. I could not tell you. Stephanie and Kelly might be able to relate to that. Or then when it was time to go back to work, my husband kept noticing it because he's with me all the time. And he was like, you're just not something, I can't get to you. He couldn't like reach me, if that makes sense. He felt like the lights were on, but nobody was home.
Yeah.
And, he came down, and like I was standing in front of the coffee pot, and he said he just looked at me, and I was just standing there staring, like in some sort of weird, I don't know where I was in myself, but just standing there staring. And he's like, you gotta be careful. Can you drive to work? Can you do this? And everything was weird. Everything was weird. And thank God I work here where I work in the health system. So our boss, Jill, told me, if you need to lay down, go lay down, but that I would just come home and sleep. And I would just go to bed and sleep for 14 hours and then get up and go to work.
So it's just such a mystery.
Weird. And I feel so bad for Kelly and Stephanie, and I hope I'm remembering their names. Kelly and Stephanie,
correct.
Right? And I hate to get the names wrong here, but I feel so bad that you feel like people think you're faking it, because I remember going on and doing an entire show. Finally, when I was back, I said, no, I can do the show that I host, the All Things Heart show, and I did it. But it took every ounce of, and I feel like I'm lucky because I was able to do it, and clearly Stephanie and Kelly haven't been able to do that, but it took every ounce of energy, and I came out, and you were like, you look pale. You told me I looked wiped out. It took every ounce of energy to get through a script that was written in front of me.
Yeah.
I knew instantly, and I feel like we all kind of know.
So isolating.
When you're in,
Yeah.
you feel isolated in your body too, because you're in this weird cloud.
Yeah. It's hard. Just that brain fog. It's like, I wish somebody could if we could all understand exactly what that felt like, but just all the accounts that I hear, it's just such an unusual feeling, and it's hard to describe. Great discussion. Let's table it for one quick second because I want to get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning to you.
Hi.
Hi, can you update us on the COVID count?
Yeah, COVID count is still low in the single digits, so 5 active infections, 0 in the ICU, 0 on the ventilator, 7 in that recovery period, a total of 12. But again, I think it is important to understand cases are going up. Why is that important? Because of our topic today. We know that long haul syndrome, long COVID, can occur even in patients who don't come to the hospital, patients with mild disease. But we also know and have very good evidence that if you are vaccinated, you do have about a 50% reduction in having those long COVID symptoms, especially further out than 28 days. So vaccine continues to offer benefits even beyond that acute illness and protecting you from hospitalization and death, and I think that's important to understand.
All right, I've got a couple COVID questions for you. Yeah. Just a report out that's saying that COVID may age our brains by 20 years. What would that mean? What are you hearing about that?
Yeah, I mean, I think this goes back to also the long COVID statement I made before. You know, we understand that this is going to be a public health and an individual health epidemic, much like diabetes, heart disease, many forms of cancer as well. And so moving forward, we know that these issues will occur. We are still learning greatly about it, how long COVID affects our organs, such as our brain, our heart, our gut, all of those things. And this is more evidence to support the fact that moving forward, we have to figure out some way to identify these issues and get these patients to see the right people so that they can get evaluated and treated as able.
Okay, so there's been also a discovery that could lead to a new way that we tackle COVID, but cells that have been affected can explode. What does that mean?
Yeah, this is just a form of cell death. So we know that COVID can infect many different cells and many different organs. This was an article published in Nature showing that the virus likely can still infect even the cells that we are using to help control the virus infection. And when they do this, they die by this process, pyropoptosis, which is just it's kind of I don't want to say a violent form of cell death, because there are other forms of cell death that go on in our body that are much less violent and have much less collateral damage. But when you have these things occurring in the macrophages, specifically in the lungs, when they are infected with COVID, that can be one reason why you are having this severe disease in the lungs of those patients that get severe disease. This may be one area that we can impact to help prevent people from getting to the ICU, or once they are in the ICU and on the ventilator, this may be one area we can impact to find a treatment for to help reduce the severity of their infection, especially with regard to their respiratory failure due to their lungs not working properly.
Okay, do you remember this headline from about a year ago? We were talking about sniffing dogs, you know, being able to detect COVID, and I was like, okay, we talked about it then, but now they're saying that sniffer dogs might be better at detecting COVID than the actual test. Is that possible?
Yeah, I mean, since the initial data was put forth, we know that further data and further studies have come out showing that these dogs are able to smell certain chemicals that are put off by the infection. And all of them have shown pretty high sensitivity in being able to detect people with COVID-19. I think even Eric Church was using that at one point on his tour to help keep his bandmates safe as well. So how reasonable is it, though, to have just massive amounts of dogs trained to do this? Probably not reasonable. I don't think we're going to be switching to that, especially in the hospital. We'll still use the PCR, but in certain circumstances, it is probably one other adjunct way that we can help detect and then prevent further spread of the disease.
Very fascinating.
Yeah.
Okay, we'll check back with you here in just a few moments. If you're just joining us, we're talking with Jill Vonfange. She is with Turning Point, helping folks with long-term COVID, long-haul symptoms cope by offering support. Kelly and Stephanie are both battling COVID long haul, and so is Alexis Del Cid. She works here. She is the host of All Things Heart. Been doing stories and sharing the stories of those with long haul symptoms for the past several months, and now you're dealing with them yourself.
Right.
I had a question for you because we've been talking about this depression, anxiety, and we just always are trying to break that stigma as much as possible. I know you've also gone through, during all of this, you went through a really unfortunate loss. You lost your mother-in-law.
Right.
And so I know that was a really tough time for you. So probably very difficult to decide, to kind of decipher between real life, heavy stuff, and then also kind of this depression and anxiety that might have anything to do with COVID. But so can you talk to us a little bit about what kind of emotional state that you've been in and how you've been coping?
Well, I feel very fortunate that I'm a month and a half out as opposed to 2 years. And so I really want to emphasize how my heart goes out to Stephanie and or Kelly and Stephanie and the long haul patients who've been going through this for years. So I feel like at this point, it's too hard to unscramble the egg of what the emotions are. It was the anxiety, though, of feeling kind of paranoid, wondering if you're acting strange. That's what I can relate to, is that anxiety and the isolation. And now ask me in a year if I'm still feeling the same way. Ask me in a year how I'm feeling in the other ways. But gosh, I can just so relate to Kelly and Stephanie when they talk about the brain fog part. I cannot stress enough to people watching, if someone tells you they have brain fog, believe them and just have empathy for them, because unless you feel it, it's indescribable. The only way I can describe it, and ladies, maybe you can tell me, is if you took an entire box of cold medication. Imagine how you feel on a couple pills, a couple Benadryls, pills. Like it feels like that. Something is not right. So it's real. I just wish I wish you could see it visually. I wish people could see it. Like if someone walks in with a black eye or stitches, something happened, but you have no idea what someone's going through if they say they have brain fog.
And feeling self-conscious, like you said, that you're just...
It's weird.
And you would ask me, am I being weird?
Yes, I did ask you that a bunch of times.
And I'm always like, you're like my favorite weirdo. You've
Yeah,
always been. And
weirder
so I'm
than
like, well, I
normal?
don't know, you kind of are like that
Yes.
anyway. And I said, just, but I was like, I want you to come back to me. I want you to come back and,
And was I acting weird?
I didn't think so. I think it was weird that you just kept asking me all the time. So I knew there was something internal with you wanting to kind of keep checking in. Like, I feel weird. Was I just weird on that meeting?
Yes.
Did I say that right? Did I
There was a
explain that
meeting
properly?
at home, and this is it was when I was still in isolation, and I turned on the Zoom meeting, and I'm with my boss and Barb MacArthur, who's a way high up, and I realized I'm wearing a robe over I had been cold and put on like a fluffy robe over my, and then I realized I'm on a Zoom wearing this like Hugh Hefner fluffy robe, and I discreetly I felt so weird, and I felt like, oh my gosh, what else did I forget?
Right.
Like I shouldn't be leaving the house. I shouldn't be in public right now. I remember feeling like that. I have no business walking around in public.
Wow, you wore a robe with Barb MacArthur, the VP of our heart center. she took it in stride, I'm sure.
I hope so. I mean, and I don't remember the meeting. I remember calling other people and being like, how was I during that meeting? Did it look strange? Was I weird? So
right.
I just wish, Kelly and Stephanie, I wish I could call everyone in your sphere and tell them that you're not making it up, and tell people to go easy on you, because you've been dealing with this for more than 2 years now.
Right. And we
And
talked
I
about,
can't even imagine that.
like on Monday, we talked about like anniversaries, and some anniversaries, are celebratory. And so you look at years and you're like, oh, I've been at, like when I was at someone like Mercy, I was like, oh, I've been here 10 years. I was so proud of that. But with the anniversary of like looking at November and December coming up on, what would that be, 2 years? See, I'm losing it too, but a little bit. So, thinking about that, we're like, that makes it hard sometimes, because when you look at how long they've experienced some of these symptoms, and not just the brain fog, but like Stephanie talked about, her heart rate, and then with Kelly with the tremors, some of those things that when I think as the time comes closer and you think this has been going on this long, it gets scary, because again, is this going to be like this forever? And then coping with that this is going to be how it's going to be for this long. and maybe forever. And so we talked a little bit about that, we've talked about that in our group, about how some anniversaries are celebratory and some anniversaries are really hard because they're not celebratory. They're just a reminder of it's been this long, and
It's been a long time.
maybe it's going
Too
to be
long.
longer.
Kelly, I want to ask you, and Stephanie, I'll ask you the same question. But a lot of people will ask, did you have severe symptoms that then led to this severe outcome? And we're finding that how severe your illness wasn't necessarily tied to that. You know, Stephanie, I know you were in the hospital, very severe. Kelly, did you have mild symptoms during COVID itself?
Yes, I had pretty mild symptoms, a headache, chills, and a little bit of shortness of breath. And then later on, the shortness of breath got worse, but I was never hospitalized. I was at home on home oxygen. But mine was pretty mild. But
yeah,
I can relate to, I guess I'm getting your name right. Hopefully you'll understand, Alexis or Alexa. I would just lose track of time because I would be spacing off, or I would go to the store with my husband and he would have to tap me to move on because I was just staring off in space. And so that also led to some self-consciousness of, am I weird? Like you're saying, am I okay? Did I get everything done? Did I get dressed right? So that was, it's hard to go out in public. It's like, I just don't want to go. I have to go when there's very few people there just to make it through.
Or if there's a line forming behind you when you're in the store and you're looking for things, like your wallet or the credit card, and you're handing them your driver's license, that's weird. And they're like, ma'am, this is your driver's license. Oh,
It is.
and then we need your credit card. Oh, right. And then there's people are getting huffy, and you can sense the crowd's turning on you. It's
crowd is
weird.
turning.
It's
It's so, you keep using the word weird, and it's like kind of like we kind of now know what you mean. It's just, I get it. We've all had that. You're like, I just feel weird. I want to get to some community questions, and we'll kind of weave a few in as we go here. But Pamela says, oh my goodness, I am so glad you're having this on today. So thank you, all three of you ladies, for sharing your stories. Jill, thank you for what you're doing for patients like this. She says she had COVID back in November of 2020. The same thing. Brain fog is real, and when it happens, I just apologize and go on and on and on. Very similar to what we've heard you ladies talking about. But she also says, she goes, so what do we do? And Dr. Hawkinson, you might have to chime in on this one. But what do we do when all test results come back as normal and we're told that it's just from the COVID you had? I have had so many tests. I've seen so many doctors. I've been told to exercise, lose weight, just kind of sent home to just deal with long haul COVID. What are people to do?
Yeah, I mean, right now we don't have that technology. We don't have that diagnostic test to look for biomarkers. We don't even know the mechanism of long COVID. And for different organs, it may be different ways. Some people could have different etiologies of the long COVID, depending on if it's in their brain, with their gut, with their lung, anything like that. So I think that is why this initiative by the NIH and the government is so important, to really understand those mechanisms, and then hopefully find, maybe diagnostic tests to help lead into which direction we should go. And then, of course, finding some sort of treatment, symptomatic, something that will help with those symptoms as well. I mean, these are all great questions. These are all questions that are being investigated, but unfortunately we are at the very precipice, the very beginning of what we are doing for this, as far as really trying to figure out what is the exact etiology. And again, for certain organs, it may be one reason that you're having those symptoms. For a different, it may be the other. And as we move forward in this, we will be getting more data, more information. And again, ultimately, hopefully that will pay off in really finding some good symptomatic treatment, something to help relieve all of those symptoms.
But Doc Hawk, it's tough because you tell people to go to the hospital, get checked out, and you want to walk away with an answer of some sort. And this is one of those we just don't have the answers to.
Yep, and I think what we have seen and heard is those people from the chronic fatigue syndrome. It's a different name that escapes me right now, but have been dealing with this for years. When there aren't blood tests to really say this is what you have, this is why you have it. Now it is getting more mainstream. It is becoming more accepted. We are learning as a medical community, but also as individual patients, really a lot of things that those patients have suffered for years. And so this new information and the voices behind this is helping to normalize this. And when you are able to do that and remove that stigma, we can move forward to really find diagnostics for this, and then of course treatment. But moving forward, those are all the things that we need to figure out.
I want to read a couple of comments to our ladies this morning, Rachel, and just thanking you for being advocates so that others know where to go to for help. Places like Turning Point, and Brett, great insightful discussion this morning. Joelle and I continue to be in awe of the courage that these folks show in telling their stories, and they wish you all the best. So I share that because I want you to know people hear you, they see you, they believe you. And they appreciate you. So another question I had for you both, and then we'll get to some final thoughts. Stephanie, how important has this group been for you? What is this big takeaway that you're having that maybe you haven't been able to get anywhere else at Turning Point? When you show up, you're there with these folks going through the same thing. What are you able to walk away with?
It's just relief, honestly. It's not needing to try to fight to prove that what I'm saying is real, what I'm experiencing and feeling is real. Before I found Turning Point, I mean, it felt like I was, imposter syndrome. And I was like, am I crazy? Is this really happening to me? Because nobody had any data, and I couldn't find anybody to talk about what I was going through that could relate to it because it was so new. At one point, 3 months after my hospitalization, I started having hair loss, which we figured out was the same thing as like postpartum hair loss. But the first day I came out of the shower and I told my husband, I was like, I think I'm losing my hair. And he was like, I guarantee you're not. Like, you're just being overreacting. And I was like, if you don't believe me, how is a doctor going to believe me? And I went full crazy with it. And I collected my hair in dated bags for a month before I went to a doctor. And I was like, I'm not crazy. Look what's happening. And then when you get to Turning Point, I got in and I didn't honestly have very high expectations because I was like, nobody understands this. And it was immediately just a huge sense of relief that, oh my gosh, you know what I'm doing and what I'm going through, and you believe me. And it's just such a weight off to not have to try to prove yourself with these people. And it's wonderful.
Yeah, and rarely with an illness or an injury would you have to collect evidence that you have it.
It's awful that burden was on her to do that.
Kelly, what is the takeaway? What do you want people to know about this group? If somebody's out there right now going, no one believes me, this is happening, and how important it is to reach out to a group like this one over at Turning Point?
It's an excellent idea. I felt like I was going crazy before Turning Point. I felt like it was all in my head. And with Turning Point, I got to meet other people who shared some of the symptoms I was going through, who understood what I was going through. And even though you can't see it on me, everybody there knew inside what was going on. And with Turning Point, you do not have to have a video of yourself. You can choose just to have no video and talk if anybody's concerned about others seeing them. It's an outlet. We need to get more people to where they can talk about their problems, the things they are going through, and hear others talk so they know that they're not alone. And that's the big thing with long haul. You feel like you're so alone in this. It's not like a diagnosis of cancer or diabetes or hypertension that they know what to do. We got it way back. I got it in October of 2020. And, back then it was really just starting of seeing the long haul and waiting to find out for a treatment or knowing how long it's going to be is very hard. And with Turning Point, the people there can really relate to what you're talking about.
I have one last question from a viewer, from Angela. What are the symptoms of long haul COVID to the heart? Kelly, was it you that was having heart issues?
No, it was Stephanie.
Stephanie, can you answer that question for Angela?
Yeah, my heart issues come up when I exercise. My career, my employment requires me to be very active, and so I have been exercising regularly for the past decade of my life, and I drastically declined on my physical abilities. So now when I run, my heart rate will jump up to 180 and stay there for the entire time I'm running. And it's not fast. So we've done tests which have come back that my heart is technically fine. It's just when I exercise and really exert myself that I see the issues come in.
So is that similar to POTS? You've done a couple of stories on POTS.
It sounds exactly like, and obviously I'm not a doctor, but I'm surrounded by them every day. Two of the women that we did a story on, All Things Heart, on one of our episodes, Stephanie, both Michaela Dreyer and Terry Allen, who I'd be happy to connect you with them after. They're the sweetest women, and they have long haul. They were both diagnosed with POTS, which is a nervous system disorder that causes exactly what you're describing. I can't diagnose you with that here. However, it's a thing. One of them can't take hot showers anymore because that's what causes her heart rate to spike. Another one's a fitness instructor. So anyway, I can get with you after this and help connect you to those women if that would help, because I know that they're open with their stories as well.
Yeah, that would be wonderful.
All right, we will hook that up, and we want to get to some final thoughts this morning. Stephanie, I'm going to start with you. What do you want us to know?
I'm just very grateful for the entire KU COVID clinic and Turning Point. Everything that I've experienced here hasn't felt like a fight to prove myself. I've been surrounded by supportive doctors and like Jill and everybody, and it's been very, like, honestly life-changing to have that kind of support system in place. So I just really encourage anybody who is going through this and needs support to reach out and ask for it here.
Kelly, if someone is watching and can relate to any of the symptoms that they have heard today, what do you want them to know?
That they're not alone and that they need to reach out and find someone. I mean, KU has been excellent. Jill starting this group has been excellent. They need to find some support system to be able to talk to others. And that helps a great deal. I know it helps me a lot. And sorry, it's kind of hard because I'm trying to find words sometimes on talking, but they're not alone, and they just need to reach out to someone for help that understands. And I was lucky enough to get into the KU COVID clinic too early on, and got referred to Jill, and Jill sent me for the Zoom meetings. But they need to reach out to somebody to talk to.
Well, you both have done a wonderful job this morning. We appreciate you very, very much. Jill, how do people get in contact with this group?
I have to start by giving credit to Kelly, because Kelly really in the group was saying, like, we need to let more people know. And so she encouraged me to touch base with you all and get this out there. So I appreciate that, Kelly. And thank you, Stephanie and Kelly, for sharing your stories. And I'm sorry if I'm tearful. Monday was a good group, but a hard group. And it's good to see you ladies today. So for Turning Point, we meet the first and third Monday of every month on Zoom. I always have to say that because it's like we're in person, but we're not. The nice thing about Zoom is that you can be anywhere. You can be in your home. And so to contact us, I think the information's on there. I see this. turningpointkc.org is our website. And then the phone number's there, 913-574-0900. And you can also, on the webpage, it has our other classes and programs and presentations that we have. So if you don't have long COVID and you're listening to this, but you're looking for some type of program that might meet your needs, take a look, because we have, I think, like 80 some classes, presentations, programs, support groups every couple months. So take a look, and there might be something there for someone.
Thank you so much for being with us today and all you're doing for the folks in our community who are dealing with what we've heard today. Alexis, final thoughts from you.
I just want to shine the light back on the work Jill is doing. It's incredible. You're giving so much hope to people, and Kelly and Stephanie for taking not only the time to do this, but you're so brave to share your story. And I know it has taken so much energy from you to do this, just to get dressed, get hooked up to Zoom, appear, talk about things, find the words, and you're probably going to just want to go to sleep after this, and you should. You should just lay down, go to sleep, close your eyes. Thank you so much for being on this show today, and I hope, and I just know you're going to help so many people who are in the same boat but haven't felt comfortable talking about it. I think it's awesome what you both are doing.
Thank you for sharing
Thank
your
you.
story. Appreciate you all very much. Great conversation today. In headlines this morning, it sounds like a made-up Hollywood virus, but this is far from it. It's called monkey pox, and it's spreading around the world. In fact, 6 Americans are currently being monitored after coming in contact with a known case. Dr. Dana Hawkinson, of course, is going to join us to talk more about this. So what is monkey pox?
So monkeypox is part of the pox virus family. Other pox virus we might have heard about, smallpox. This is different than that, but also chickenpox. So basically what this is not a new virus. This was originally discovered in the 1950s from some infected monkeys, but that, just as humans are incidental hosts, it probably actually comes from and normally is present in rodents. It normally, and for the most part, has really occurred in Central Africa. Most common nations that had previously had it were Nigeria, Democratic Republic of Congo, the DRC. We know that in July 2021, we had one case. It was a patient who came over from Nigeria. We know that in 2003, there was an outbreak of humans here in the United States because they had got infected from infected prairie dogs that had come over from Africa as well. So this is not new, but what is new is the amount of cases that we're actually seeing in humans right now. There is no specific treatment. There are some antivirals that you can use, but for the most part, it is really going to be, if we know that there are clusters, what they did in 2003 was actually use the smallpox vaccine to those people that might be contacts. That does help protect you. We know that people that have been vaccinated with smallpox vaccine are protected. We also know, in contrast to smallpox, the death rate is not as high as smallpox, so that's good. It tends to be about 5 to 10%, but some of that may be just due to the care that you're able to get here. And we know if you can get better care, you probably have a lower chance of death. Basically, you have, just like chickenpox, similar to that, you have lesions that pop up on your body. It takes about 2 to 4 weeks before they resolve, but they can be blisters, rash, pustules, all of that kind of thing. So right now we are continuing to monitor. They also are investigating, the CDC is investigating clusters of people who really haven't had known exposure to animals per se, but probably had exposures to people who were infected. It's spread by respiratory droplets, just as chickenpox, but also contact with the human, the fluids or part of the vesicles that could be contagious.
All right, one last question. So we have one confirmed case here in the U.S. It's in the state of Massachusetts. What is a concern when we hear one case? Doesn't sound like a big deal. Can that turn into a big deal? What does that mean as far as any precautions that should be taken, anything we should be looking out for?
Just, again, be looking out for, they have a prodrome, fever, myalgias, maybe sore throat, headache. You then do develop a rash. I think it's important to understand that. Seek medical care or at least an opinion from a medical professional about that. Again, treatment is mostly supportive, but it's important to understand and identify these cases because we really need to identify who could be in contact with you and get them the proper post-exposure prophylaxis, i.e. probably the smallpox vaccine that has been used in the past.
All right, thanks for that update, Dr. Hawkinson. Up next, cracking down on deadly bedding for infants. President Joe Biden has now signed the bill called Safe Sleep for Babies Act. This means that sleepers that have a slanted surface greater than 10 degrees and crib bumpers, which include padding or vinyl bumper guards, but not padded mesh crib liners, they can no longer be sold. So companies have 180 days to make changes and stop selling those products. More than 200 infant deaths are blamed on bedding. Well, Alexis is going to be back at 10 o'clock for All Things Heart. So tell us, my friend, what's going on today?
We're talking about sleep and the heart, and everyone can relate to this in one way or another. What happens if you're not getting enough sleep? What happens to your heart? And let's just say you're going to bed at a reasonable time, but you're still waking up exhausted. That could be a sign of a serious sleep disorder that could lead to devastating heart complications.
Hey, how are you doing?
Good, how are you?
About an hour before he had a team of surgeons huddled over him on the operating table, 32-year-old Aaron Clark talked with us about his biggest hope after all this is over.
I'm looking forward to being able to breathe without using Afrin and just actually feeling rested for once in my life.
He doesn't remember a time ever where he woke up feeling that way.
So I snore really bad, and I always knew that I did. I thought it was just sinus issues.
It turns out Aaron was suffering from something far more serious, sleep apnea, a condition in which your breathing stops periodically throughout the night.
So the tongue collapses into the throat when he sleeps at night and obstructs his breathing.
Plastic surgeon Dr. Ravi Garg explained the special surgery he's now performing.
So we're going to move both jaws forward. The upper jaw is going to come forward, and the lower jaw is going to come forward to meet it, to close the bite and open the airway.
They're also cutting Aaron's chin bone and moving it forward. It's a surgery that will last several hours, the recovery far longer. Aaron won't be able to eat solid food for several months, but he knows at the end of this journey, it will be worth it.
That's where the benefits really set in, because with sleep apnea, you run the risk of, higher chances of stroke and cardiac-related issues. I'm looking forward to actually having a full night's sleep.
Let me tell you, that surgery was something to watch. It is just wild what doctors are able to do. Coming up at 10 a.m., we're going to go into depth into this topic. You'll get an update on how Aaron is doing today, and you're going to meet another patient that had the same corrective surgery almost 2 years ago. So you're going to hear from the craniofacial surgeon, Dr. Ravi Garg, and a cardiologist, Dr. Brian Wyford. They're going to answer all your questions live on All Things Heart about sleep, sleep disorders, the heart at 10 a.m. coming up on All Things Heart.
The more and more shows that we do, the snoring and the sleep apnea, finding that so many people suffer from it, and you think snoring is snoring. How bad can that be? What kind of problems can that be causing?
It causes problems in a relationship.
Yeah, I do know that.
Because everyone I've talked to says, of course, they were alerted by whoever their partner was, because when your partner's snoring, they're the one to tell you, and usually the other person's like, I don't snore.
Right, and then you have to, I've been recorded snoring.
Right.
But this is what guest rooms are for. Right? Get out.
Yes, so you'll see.
All right, well, stepping up to the plate to promote good mental health care. Thousands of Royals fans packed Kauffman Stadium last night for the annual Royals for a Cause event, Mental Wellness Awareness Night. This was a look outside of Gate A last night. Folks had a chance to learn more about mental wellness using an interactive virtual game.
I think that having mental health discussed at this level and bring it to the stadium where everybody who's coming here just to have a good time can have this raised as something that they're going to talk about and wonder, hey, why are we here? It's so important because it starts a conversation. For people who might be struggling and might not feel comfortable talking about it, this gives them that window and that kind of doorway where they can access these feelings, talk about this stuff with their friends and family, and it comes out of the darkness and into the light. That's what's so important.
Dr. Dwalnick there in his happy place. He loves this time of year where he can talk all about it and be surrounded by great Royals fans. Fans were encouraged to wear lime green to show support for those battling mental health issues. It is estimated 1 in 5 Americans suffer some sort of mental health problems. Unifying Kansas City and making the metro stronger. That's the goal of this year's Kansas City Parade of Hearts. The public arts experience is spreading throughout the Kansas City area. We were there back in March when all 155 hearts were first installed and revealed. There they are. They were designed by people here locally, including some employees at the University of Kansas Health System. As you can imagine, these hearts are drawing plenty of attention, all sorts of fun stuff. I actually was driving by today and some lady had her big, huge Labradoodle standing out at like 7 o'clock in the morning, taking a big picture of them. So people are loving these. I love seeing all this. All of the hearts have been placed throughout the Kansas City area, and people have been going around and doing it. And you can take selfies, and I guess there's an app out there now that you can check all this out. So you can find the heart closest to you by going on that app. And oh, is Anthony going to show us some of this? We got Anthony.
I'm standing outside of the University of Kansas Health System next to one of the amazing hearts from the Parade of Hearts, Kansas City. We have an amazing tool to get you to navigate all of those hearts throughout the city. Let's get into it. Simply start by downloading the free Parade of Hearts app on your Apple or Android device. Once you've downloaded the app, you'll have access to all of its great features. You can learn about each heart's artist and inspiration. You'll have access to an interactive map that allows you to navigate neighborhoods with hearts and track hearts that you've already seen. You can even create your own heart. Check out the one I made. What do you think? I know, I'll keep my day job. But in the meantime, this is a great activity to do alone or invite some friends and family out with you on the trail. I'm Anthony Nickens. I'll see you out there.
That is funny. All right, Anthony, I love your heart. I'll take your heart anytime, my friend. All right, well, more than 30,000 people have downloaded the Parade of Hearts app with a total of more than 1.2 million check-ins at all the hearts. I'm telling you, every time you drive by, you see somebody out there taking pictures. So that was super fun. Thanks, Anthony, for doing that. And thank you so much for being with us today to talk about this really important topic. Don't forget, you can catch our show anytime by logging on to Facebook, YouTube, and on Twitter. Go out there, make it a great Thursday. We'll see you back here Friday at 8. Coming up tomorrow on the Morning Medical Update, a 24-year-old pregnant mom with COVID survives thanks to ECMO, a machine that acted as her heart and lungs. I'm Jessica Lovell. We hear her story and meet her 9-month-old. That's Friday at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.